It gives me immense pleasure to welcome you all to the National Conference on Yoga for One Earth and One Health, an integral part of SBV Yoga Mahotsav 2025, commemorating the 11th International Day of Yoga. This event is being organized by School of Yoga Therapy of Institute of Salatogenesis and Complementary Medicine of Sri Balaji Vidyapeeth, in collaboration with Indian Yoga Association, Sri Aurobindo Society, Pondicherry University, and the International Center for Yoga Education and Research, Ananda Ashram. This event is supported by Ministry of Ayush under the Yoga Samavesha signature event. To begin the first session, we have a great opening batsman, a Vishwaguru. Sir is a respected personality in the field of yoga therapy, yoga education, research, and integral medicine. And wherever he goes, Dr. Sir brings a unique blend of science and spirituality to the table. Now I request Professor Anand Balayogi Bhavanani, sir, Director ISCM, to deliver a talk on yoga and mental health. Over to you, sir.
Namaste, Vanakkam, Swagatam, good morning everyone. Are we all awake? Good morning.
Good morning, sir.
I don't know if you are awake. Good morning.
Good morning, sir.
I still doubted, half asleep. Good morning.
Good morning, sir.
Okay, now I know you are all awake. Okay, fine. I request everyone to sit quietly. Try to keep your spine aligned, eyes closed. And for a few moments, let us focus on our breathing. It is the breath that enables us to be alive. The prana, the universal force that comes through the breath, enlivens us. It is the catalyst of all life. Let us focus on the breath a few moments. Be aware as you breathe in. And be aware as you breathe out. Breathing in and breathing out. Breathing in and breathing out. Let us begin today with a Vedic mantra that wishes that we all work together, learn together, grow together, glow together, and become the best version of ourselves without friction amongst ourselves. Sahana bhavatu Sahanau bhunaktu Sahabhiryam karvavahai Tejasvinavadhitamastu Ma vidvishavahai Om Shanti Shanti Shanti. Om Shri Gurubhyo Namaha Hari Om. This morning, I'm going to take the next 20 minutes to help us all understand a bit more about the role of yoga in mental health. So my first question, how many of us in this room today are right now feeling happy? Can you put your hand up? Okay, fine. I will not ask you to prove it with randomized controlled trials, so don't worry about that. How many are feeling so today? Plus, minus? Oh my God. We are on extremes, that means today. And how many of you are not feeling so happy today? Be truthful, ma. Idu onna prachana illa. Idu exam illa. Mark poda matom. Okay, fine. When we talk about mental health, it is not just a few psychometric tests. For example, we have the DAS, we look at depression, anxiety, and stress. We look at the PSS, perceived stress scale. It's not just about that. We can test your cortisol levels. You know what is cortisol? It is the chronic stress hormone. Now we have two types of stress. Because when we talk about mental health, we have to talk about stress. Because that is the major pandemic we are suffering today. We thought COVID was the pandemic. The pandemic was the stress pandemic, the fear pandemic that has broken us down and made us vulnerable to the impacts of the pathogens. This year's topic of Yoga Day, the theme is One Earth, One Health. Because is it enough to say, I am healthy? I don't think so. We are healthy? That's better. This whole planet is healthy. Well, that is where we want to move. Yam petra inbam, peruga ivvayagam, said this beautiful Tamil culture. Yadum ure, yavarum kelir, said the same culture. Our Agananuru, Purananuru has teachings that have shown the grand perspective of this culture of Tamil. And this culture is something that we should be proud of. Our Indian culture, Bharatiya Sanskriti, has always looked at the bigger perspective. It's called Vasudhaiva Kudumbakam. And Vasudhaiva Kudumbakam doesn't only mean human beings, it means all living beings. Vadum Payave Kandu Vadinen, said Vallala. That is the type of capacity we had for Jiva Karunya. Today we have no Karunya at all. Even people whose name is Karuna don't have Karuna. And I hope none of you are called Karuna in this hall today. Anybody Karuna in this hall? Okay, fine. Escape. Stress has two types. One is the acute stress. The second is chronic stress. So what is acute stress? Acute stress is when you are on the way to the college today and suddenly an idiot drives their scooter in front of you and you have to put a sudden brake. It happens to me every day while I drive here. There are enough idiots on this road from Pondicherry to Kadalur that they will test it once at least. Acute stress is an emergency where my survival is threatened. I hope you understand that. Your survival is threatened, hence your body systems utilize the autonomic nervous system to help you save your skin. So what happens in acute stress? Your heart rate goes up, so your blood is being pumped. You have the musculature. It gets the blood supply so that you can run fight or flight response, the sympathetic arousal, through what is called hypothalamo-sympathetic medulla, SAM. Sympathetic adrenal medulla. You can remember it, SAM, the SAM response. That adrenaline that is pumped enables your eyes to dilate, so you can see the enemy better. I can see you better, so I can either fight or run away. My bronchial passages open up, so I can breathe better. But at this time, who cares if I'm digesting or not? So your digestive system doesn't get enough blood, and your reproductive system is the last thing on your mind when you're trying to save your skin. So reproductive system, digestive system don't get much. That is your acute stress. And it is good, it is necessary for you as a human being to just be alive. So fine, I'm not talking about that. But what happens is, every time, now my father used to say, Swami Geetananda used to say, saber-tooth tiger phenomenon. Saber-toothed tiger. Once upon a time, we lived in the caves. Okay. Now, we Indians got out of the caves much before the Europeans. We Indians got down from the trees way before the Europeans. That is why Indian culture, the history is millennia. Okay, which is very difficult for people to stomach when they come from other cultures. They don't want Indian culture to be so old. So they say, no, you're all fabricating. It is a myth. When you are in a cave and you come out of the cave on a morning like today, and there is a saber-toothed tiger. You know saber-toothed tiger? Ice Age, there was one film, animation film. Huge saber-toothed tigers, and that saber-toothed tiger, namaskar sir. A saber-toothed tiger is there in front of you when you come out of the cave. Now you come out of the cave, there is a saber-toothed tiger. What can happen? Saber-toothed tiger will eat you for its breakfast. Now depending on our size, some of us will be a nice breakfast, some of us will be a pre-breakfast snack, and some of us will be breakfast, lunch and dinner. Okay, that depends on our size. Saber-toothed tiger will eat you. Your survival is threatened. Hence, your sympathetic system, sympatho-adrenal medulla, SAM system, hypothalamus through the autonomic system, sympathetic medulla, enables you to either fight the tiger or run away. You survive. But what happens today is that everywhere you look, you are seeing a saber-toothed tiger. You get up in the morning, you look at the person next to you in the bed, you see a saber-toothed tiger. You get out of bed, you see your children or the children see the parents, you see a saber-toothed tiger. You go outside, you see your neighbor, you see a saber-toothed tiger. You get in the bus, there's a saber-toothed tiger. You get off the bus, there's a saber-toothed tiger. You come to SBV, there are a lot of saber-toothed tigers. If you are a professor, you see the students as saber-toothed tiger. If you are a student, you see the professor as saber-toothed tiger. Constantly what is happening? Stress, 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 stress. And this is where chronic stress happens. Chronic stress is when you are not having a chance to let go of the stress. Our stress mechanism was built in such a system, the sympathetic drives you into activation, and that should be followed by parasympathetic deactivation. In yoga, we call it spanda, nishpanda. Activation, deactivation. And activation followed by deactivation enables you to be balanced. Now, deactivation followed by activation, do you think you will be balanced? No. That is why activation followed by deactivation is balance. Deactivation followed by activation will always be activation. And this is why in yoga, we always teach, do all the practices. Activate your system, your circulatory system, your respiratory system, your endocrine system, your nervous system. And at the end of the class, please lie down in Shavasana for 10 minutes. It is in that Shavasana relaxation that the benefit of all your yoga practice comes to you. We have done a path-breaking study at what was CITER before ISCM, where we showed lying down in Shavasana relaxes you, but if you do some asanas before it, your relaxation is more deeper. If you want to relax fully, you first have to activate. So chronic stress, which is seeing the stressor everywhere all the time, what it does is it comes into a new pathway, hypothalamo, pituitary, adrenal axis, HPA axis, and this is cortisol. Now cortisol, I'll tell you, is the most dangerous hormone we are dealing with. And during the pandemic, we all had high levels of cortisol. Dayanidhi did a study for his PhD of salivary cortisol, and we showed how all the subjects there, cortisol levels were going up, but in those who were doing yoga, the going up was not much. It was more balanced. It didn't go down because there was stress everywhere. There was chronic stress. But the yoga practice brought down the rise of cortisol, so at least you were still where you were standing, you were not thrown back. And that is why when we talk about stress, and chronic stress especially, that is the bane that destroys mental health. Why do you have issues with your mental health? Because you are always comparing with somebody. She has a better salary than me. He is more educated than me. His girlfriend, nowadays sab kuch chalta hai. His girlfriend, her boyfriend is better looking than mine. You know what happens? You get a job. Say you get a job at SBV, right? At ISCM. We don't have any positions vacant right now. For Karaikal, we are looking for some yoga and music therapists. And our VC sir has suggested we should do. So if some of you want to apply and go there, that is fine. But imagine you get a job at SBV and you are told you are being appointed and you will get a salary of 60,000 rupees per month. Now you are very happy. You have just passed out and you are getting an offer 60,000 rupees per month. You are very, very happy. You join the job. You're all, in that. Today is the greatest day of my life. I am so happy and all of that. You come and meet everyone and after about 2 hours, the usual thing, tea break. So you go to the canteen or someplace and you are with your colleagues and you're having a cup of tea and you start discussing your salary. And now you find out somebody who's joined, who is in the same rank as you, is getting 65,000 rupees. What happened? All that happiness of having a job and 60,000 evaporated the moment you saw somebody else has 65,000 for that same job. You get 98% in your exam. You are very happy. And then you get to know one of your classmates got 99. This becomes this. This is the whole problem of the human dichotomy. We are either on this extreme or on that extreme. And that is why Lord Krishna, Yogeshwar in Bhagavad Gita says, neither this nor that, find that balance in the middle. It is called yukta. It is called mitha. Your diet should be mitahara. Your life should be mitha and yukta. He says, yuktahara viharasya, yukta cheshtasya karmasu, yukta swapnavabodasya, yogo bhavati dukkha. Your dukkha, your suffering will be destroyed. Ha means to destroy. Dukkha. If you are moderate in your eating, your activity, your relaxation, your sleep, when there is moderation in your life, you are in the middle. Where does balance lie? You have all tried balancing a scale, I'm sure. Scale வச்சு balance பண்ணுவீங்க தானே? கிளாஸ்ல போர் அடிக்கும் போது இப்படி நடுவில் இப்படி கை வச்சு இப்படி உழுதா அப்படி உழுதா பார்ப்பீங்க. இங்க நானும் ஸ்டூடெண்ட் காலத்துல ரொம்ப நாள் ஆகல. It's not been too much time. We all do that. We play with that or the pencil. If not scale, pencil. And when you get bored with the lecture, you will be playing to balance that pencil and see if you can get that point where it's exactly balanced. Balance is not on this end. Balance is not on that end. Where lies balance? In the center. Can we do that? Where lies balance? In the center. I didn't hear you. In the center. In the center. In the center. In the center. Okay, fine. In the center lies balance. Balance is in moderation. Be it Buddha, be it Patanjali, be it any of the great masters of the past and the present, they have always suggested, look for the path of moderation, the golden mean. That is where balance is. This is why many people say yoga makes you parasympathetic dominant. I disagree. Why do I disagree? Yoga is not about making something dominant or something non-dominant. Yoga is all about balance. Lord Krishna says, Samatvam yoga uchyate. Yoga is harmonious balance. What is that balance? It is the equanimity. Somebody says, good job. You don't become too happy. Somebody says, you are the most useless person I ever saw in my life. You don't get disheartened. It is called mana apamana. When you are given recognition also, you are not overjoyed. When you are not given recognition also, you are not dejected. Because you have understood Both are the twin imposters. Rudyard Kipling in his poem If, he talks about if you can realize the twin imposters, which are fame and failure, success and failure. That is what Krishna says. Siddhya asiddhayo. Siddhya means achievement. Asiddhayi means non-achievement. Samabhutva samatvam yogochate. But that is also in your body. It is called homeostasis. How many of you have heard the word homeostasis? Put up your hand. Students, physiology. You have had classes, I'm sure. Shobna ma'am will get very mad if you don't know homeostasis. Homeostasis means your body is always trying to find balance. I sit down, the body wants balance. I stand up, the body wants balance. I bend down, body wants balance. I turn, I do this, I stretch, I run, I stop. The body wants balance, homeostasis. Okay? Now this homeostatic mechanism is totally governed by the hypothalamus. The hypothalamus governs the whole homeostatic mechanism. But when you have chronic stress and the cortisol level is going up, what is happening? Your body is struggling. Your body is being attacked on all sides. Every cell in your body is being attacked. So what does the body do? It says, I want to maintain normalcy. I want to maintain balance. So the body is struggling against this chronic stress. Like Hanuman lifting the mountain. You are lifting the mountain. The body is lifting the mountain, trying to maintain normalcy. That is called allostasis. Have you heard that term? No. Homeostasis is normal balance. Allostasis is the body trying to maintain balance in an altered situation. I say it is altered homeostasis. Allostasis is your body is trying to say everything is normal. Somebody says, are you okay? Yeah, I am okay. And they turn around. But you are trying to say, I am okay. For that, the body is struggling. That is the allostasis. 1 day is okay. 1 week is okay. 1 month is okay. After 3-4 months, what happens? The body gets tired of putting up this brave front. You are tired of putting on this mask called personality. Personality is a mask. You are tired of trying to act normal. You are not normal. Normal is homeostasis. Acting normal is allostasis. And the load becomes so much, it exhausts your whole reservoir, and then you go into exhaustion. Acute stress is the alarm reaction. The second is resistance. The body trying to act normal. And after some time, podumba mudilapa, you collapse. Exhaustion. It is in exhaustion that all the psychosomatic disorders manifest. All the psychosomatic disorders, today we call them non-communicable diseases, lifestyle disorders, all of them are either caused, aggravated, or worsened by stress. Hence, yoga, as the best ever anti-stressor, needs to be brought into everyone's life. Yoga is the best vaccine against stress that has not yet come. It is the best antidote to stress that has already occurred. It is the vaccine and the antidote. And this is why learning to reduce the stress response, learning to bring on the relaxation response will enable the healing response to manifest. Stress response is inversely proportional to the healing response. Relaxation response is directly proportional. So the more you learn to educe the relaxation response, remember it is non-pharmacological, so no side effect. Non-pharmacological, self-directed educement of relaxation response will enable healing to occur. So before I end, a few rounds of a very beautiful technique to release stress. What we are just going to do is we are all going to stand up from wherever you are. Not a prolonged thing, 30 seconds, because we are going to listen to one of the great leaders of our modern yoga world, Professor Ilangovan sir, next. And so I don't want to take up time from Sir's talk. Put your hand on your abdomen and let's just start making a beautiful sound of ha. The sound of ha is balancing the solar plexus, the Nabi chakra, which is the Manipura chakra related to the cosmic connection. Like the baby has the umbilical cord connected physically to the physical mother, we have a psychic umbilical cord connected to the psychic mother, which is the universal mother, Jagat Janani. Ha! சாப்பிடல கவலைப்படாதீங்க, இனாகுரேஷனுக்கு அப்புறம் நல்ல ஹைட் இருக்கு. ஓகே, ஹா லஞ்சும் இருக்கு. ஹா 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 ஹா. Okay, now you can sit down. Now you all feel better. When you make this sound, you know what you are doing? You are bringing into your bloodstream something called serotonin. Serotonin is found in the brain. Lack of serotonin leads to depression. Serotonin is in the brain. More serotonin is in the gut. The gut-brain axis, ha sound enables that to be released. Endorphins, enkephalins are your feel-good hormones, feel-good neurotransmitters. Those are secreted when you make this sound. And that is why Tamil என்ன சொல்லுவாங்க? வாய் விட்டு சிரித்தால் நோய் விட்டு போகும். Once more, வாய் விட்டு சிரித்தால். Once more, வாய் விட்டு சிரித்தால். Thank you so much.